Okay. Um, that's good to know. So are you, I know one of the things that you are advertising a lot in your programs is the ability to get on-site, actual hands dirty kind of experience.
Yeah.
Is that something you're still able to provide right now with the new site?
Yes, since the pandemic, we have not had any intern physically come in to
Okay.
this day. We've done everything remotely, and it's actually even better because you don't have to pay for a flight and a hotel and all that stuff. And it's a breast cancer study, which we only started offering that right around the pandemic, actually, like a little before the pandemic. So you basically can do more internship without traveling by doing our breast cancer study. They're basically junior CRAs doing IMV reports,
Okay.
but instead of like doing one IMV report for all the patients, because we have a lot of patients in this study, we do one IMV report per patient. That's the only difference between like what you do as a CRA when you go out and what our interns do is, hey, focus on patient two. Your report is going to be all about patient two. Your next one's going to be all about patient three, and so on.
Okay. That's definitely good stuff. And of course, we all know this industry is all about experience. It's not really about your fancy degrees and all this stuff. It's all about experience. So, really, I don't even recommend you spend a dime on anything unless they've given you experience.
Absolutely.
So
That's
that's
how to
why,
spot a scam. That's actually how to spot a scam in this industry. Is, dude, I saw like the other day, Monica sent me a link to some program I never heard of. Pay $300 and get certified as a CRA. That's nonsense. You and I know that's nonsense, right?
I,
But somebody who's just learning doesn't know it's nonsense. They think that there's actually a certification.
you're right. I mean, I get emails all the time about what certification should I go get. And the reality is, you really just need experience. I mean, because they're going to give you all the certifications you need once you start working anyway.
That's right.
Um,
ACRP, they usually think ACRP and SOCR, but those places are not meant for entry level. Like they don't
right,
want to talk to you. They
right.
don't want to hear about you until you're like 2 or 3 years in.
Exactly. I mean, you can't even take the exam. I think for one of them until you've had some years of experience.
Yeah, it's almost like it's an hour. At the time I looked, it's an hour. It basically translates into like 3 years.
Yeah, yeah. So I mean, I don't know. I don't know where people are getting this information from. I guess it's the marketing of these big companies, but
It's bad word of mouth.
yeah,
There's good viral marketing and there's bad viral marketing. And in this case, I see a lot of this bad viral mark. I also see a lot of scams where people are training CRAs and they're doing their CVs for them on companies that don't even exist, and they're putting like senior CRA on their resume, and then they come to me and say, "Hey, I just want to do your internship, but hear me out. Here's why. I don't need your academy because I'm a senior CRA. Here's my resume." So I used to get curious, so I would Zoom like we are right now,
yeah,
and I would say, "Okay, well, what's 1572? What's IRB approval?" They're like, "Huh? What are you talking about?"
right.
I'm like, "How are you a senior CRA? You don't know the
The
basics."
basics. That's the absolute basics.
I mean, senior, even like a clinical research assistant, first week on the job would know what that is.
Exactly. Exactly. Yeah, there's a lot of scams out here, and there's a lot of fake CRAs, but I think the companies are really starting to crack down on it now.
Yeah.
I know the
There's
company.
actually a list. There's a list of fake companies. It's a long list. I know this recruiter who told me that, and I'm like, hey, check if my company's on there. It's not. So far, it's not, but it's only a matter of time because what I started seeing, ECRG, I almost said your name. What I started seeing is on LinkedIn, this person who was interested in the CRA Academy messaged me. So I looked at their profile, and they put that they're a senior CRA for my company, like on their LinkedIn. I told them, man, you're gonna get me blacklisted. Like, you can't do that. You need to take that off right away.
Right.
You can't be doing that.
That's messed up. They're about to
Yes,
get
it
you in
is.
trouble.
They are. It's a good thing I know a few recruiters, so if we do get on that list, they'll tell me, and then I can tell them, hey, no, no, take us off.
There you go. There you go. So let me ask you this: the pandemic obviously has been the talk of the town the past year and a half or so. And I think last time when we talked a couple weeks ago, we talked about it mainly from the CRO and sponsor side of things, how it was affected, and especially I'm a CRA, so I talked about it, remote visits and remote monitoring and that kind of stuff. But from the site perspective, how how did sites typically handle the change to the remote monitoring, less CRA monitoring on site, and even not even being able to go on site? How did your sites handle that? And then can you speak to largely like how sites, I guess, nationwide handled that?
Yeah, I mean, I think people started getting scared around March, panicking around April, May, and then June things started getting back to normal. But it was like a false hope because the second wave came, as
Oh
we all
yeah,
know,
oh
in
yeah,
the winter. But since that June of last year, monitoring's back. Like, I mean, you go to sites now, right? Like
most of them, yeah,
most sites, like the ones that won't let you in are usually the academic medical centers.
yeah.
But the smaller sites, like the ones that I own or consult for, I mean, they prefer in-person visits, and they prefer the monitors to come in rather than the remote monitoring. It's almost 100% of the cases where they prefer that. So from June of 2020 till present, I think monitoring's back to normal, and sites only had to really adapt for like 3 months or so.
Okay. Did you notice any issues with like funding as opposed to like getting paid for in-person visits versus remote visits? Was there like a funding decrease or anything like
No,
that?
no. The budget stayed the same, so it was just the monitor with SDV remotely as opposed to coming in. Usually, sites get paid when the monitor SDV and then confirm the visits. So then that usually triggers a payment. So whether they do that inside or remotely, it doesn't really matter. But I do know a lot of sites requested a extra budget, extra overhead due to the extra cleaning that they had to do,
Oh, I
especially
see.
in the midst of COVID. Like they had to hire professional, like medical grade cleaners. Um, the materials was more expensive, as you know. The materials harder to find.
Yep.
I mean, try finding Lysol or any hospital grade disinfectant
Yep.
in like April of last year.
Impossible.
Yeah, so they asked for increase in overhead, and I think a lot of the sites have been able to continue getting that overhead. Chris does most of the budgets, but I talked to him enough now, and definitely with my new clinic out here in Yuma, he's negotiating the budgets for us. So we're asking for, and we're taking all those precautions too.
Okay. That's good to know.